I've never been to a magic show, but always wanted to go. And recently an opportunity presented itself. I went to a neuro-ophthalmology conference that was taking place in Las Vegas. And I thought that this is my chance. I decided I'm definitely going to a magic show. Now, there are a lot of magic shows to choose from, so I had a difficult time deciding. So I thought once I get to Las Vegas, I'll just pick one there. So on my ride from the airport to the hotel in an Uber, there were lots of big billboards advertising all kinds of magic show. But one particular one caught my fancy. It had this older woman in a magician's outfit, and the show was called Miss Jacob's Show. Now, right underneath this picture, there was this photograph. And right away, I started thinking, what does that mean? What could it represent? And of course, I was going to a neuro-ophthalmology conference, so the first thing that popped into my mind was that Miss Jacobs has a homonymous hemianopia. Now, the cab drove through this billboard pretty quickly, and I didn't have a chance to read more about it, but then, of course, I quickly Googled it, and peculiarly, the brochure stated that the Miss Jacobs shows, because the Miss Jacobs cannot see anything to the left, she wants everybody to sit only on the right side of the audience, which I thought was really bizarre. And of course, I started thinking, what's going on with Miss Jacobs? Why can't she see to one side? Why does she have this homonymous myopia? And of course, Miss Jacob being about 70 to 80 years of age, I thought that she must have had a stroke in the past. Then I started reading through the audience comments, and many people mentioned that Miss Jacob has some mysterious illness for which the cause was never found. So she has this homonymous myopia, but nobody knows what really caused it, which really perplexed me. And I started thinking, what could she possibly have? Now, once I got to the show, it was a bit of a letdown. There was a bunch of, other than the fact that everybody was sitting to the one side only, the tricks were something that I've already seen before. And throughout the show, I was kind of noticing there was something a little bit off about Miss Jacob, but it was a little bit difficult to put my finger on it. Then I realized that it took her time to pick the right words sometimes, and at other times she seemed a little lost, and it really clinched at the end of the show when she pulled out a rabbit out of her head, and then it took her like a second to figure out, to name what it was, and then she called it a cat. Then I realized that Miss Jacob had a super subtle dementia, hyper subtle dementia. So I started thinking, what could it be that caused this Miss Jacob have the homonymous defect and be so mysterious? And of course, the most common reason for the homonymous defect, where the neuroimaging is called normal, is that there is a defect in imaging, it's just simply missed. And you can see it here, where this patient has a stroke in the posterior circulation, which is of course there, but really not uncommonly missed. So missed lesion on neuroimaging is the most common cause of otherwise normal neuroimaging. Now, turns out that there's another condition which is really, really quite rare, and that is Jacob-Creutzfeldt disease, and specifically the Heidenheim variant of Jacob-Creutzfeldt disease, where patients present with really visual manifestation only in the beginning, and homonymous myopia is actually one of the most common manifestations of the Heidenheim variant of Jacob-Creutzfeldt disease. And the neuroimaging in these patients is often normal. You have to get a particular imaging study, and specifically you'd have to look at the diffusion-weighted imaging here in order to notice subtle increased signal there, and this will almost invariably correspond to the decreased perfusion in the posterior cortex on the PET scan. So missed lesions on neuroimaging as well as Jacob-Creutzfeldt disease are the first two causes of homonymous myopia where the imaging can be called normal. So remember, Miss Jacobs has hyper subtle dementia. So the other cause for the homonymous hemianopia with normal imaging is acute hyperglycemia. Turns out that in rare cases, patients with acute hyperglycemia can present with homonymous defect. And that is thought to result from the overall hyperosmolar state, which then results in the dehydration of the cells, presumably in the occipital cortex, which causes these homonymous defects. Oftentimes, these patients would also have positive visual phenomenon, which is thought to be due to the seizures originating from the occipital lobes. So, Miss Jacob's hyper subtle dementia. So hyperglycemia is another cause. And then patients can have very, very subtle lesion on imaging, which can be missed. And here's an example of a lesion in the lateral geniculate body, which is one of these most common locations where the lesion can be very subtle and thus be missed. So you can see here, this is a T1 weighted MRI where it looks really almost perfectly normal, and not until the contrast is given that this abnormality in the lateral geniculate body lights up. So the abnormalities in imaging can be very subtle. Here's another example of a patient whose imaging was called normal, but patient actually had a subtle atrophy of the occipital lobes. And you could only see it when you compared the imaging that was done 6 months previously to this one, to notice that the occipital lobes have really shrunk. So Miss Jacobs has a hyper subtle dementia. Now, the last cause of a homonymous defect where the imaging is normal is posterior cortical atrophy, which is a variant of Alzheimer's dementia. So a proportion of patients with Alzheimer's disease will present only with posterior cortical atrophy. And their main clinical manifestation might be homonymous defect. And their neuroimaging might be interpreted as normal. And here is an example of a patient with a posterior cortical atrophy on this side compared to the age-matched control. And the findings are very subtle. As you can appreciate, the occipital lobe here a little bit shrunken compared to the normal person. And it is the PET scan that really gives it away. On PET scan, patients with posterior cortical atrophy demonstrate definitely decreased perfusion in the occipital lobes. And that corresponds to the brain blood flow study, which demonstrates decreased blood flow in the occipital lobes here as well. So remember, patients who have homonymous defect and have normal neuroimaging, remember about Miss Jacob's hyper-subtle dementia. The lesions could have been missed. The patient could have Jacob-Creutzfeldt Disease. They can have acute hyperglycemia. So all patients with acute homonymous defect who look unwell, you should send them to the emergency room to have the blood sugar tested. They could have very subtle lesions, or that could have posterior cortical atrophy and be demented.